Receiving the diagnosis of cancer is a shock. It turns your life upside down. But we underestimate what a shock it is to finish the treatment for cancer. One reason is during treatment, patients feel like they're doing something about the cancer. And once you finish treating it, then it's a waiting game. And it can be nerve-wracking because what do you do after that? Well, you're not getting chemotherapy, but what are you doing? Well, we're waiting to see if the cancer is coming back or not. And this can be very, very stressful, and it's a very different kind of stress than going through treatment. Addressing this emotional dynamic is very, very important. I have patients, for example, who don't like for friends to reach out to them because it makes them feel like, oh, you remind me I'm sick. I have patients on the contrary who thrive from having friends visit and call and reach out by Facebook, emails, and so on. There are national guidelines in terms of how to follow up a patient, and it entails regular visits to see the oncologist, usually every 3 months for a couple of years. After that, every 6 months for another 3 years, and then once a year. We became over the past few years more aware of what's called survivorship. And one part of survivorship is actually that some of the treatments you're going through, like radiation, chemotherapy, can cause problems. So we're now savvy about following. For example, somebody getting radiation in the region where the heart is, we want to follow with the cardiologist and check certain labs to make sure there's no complications from cancer. Even when you are diagnosed with a lung cancer, even then, if you stop smoking, you tend to do better. Another way is diet. The other one is to keep active. Patients who keep active, and sometimes it means to get on the treadmill, go back to the gym, it can make a big difference. Treating cancer, it's a team's job. We have here a very strong patient navigation program, and they're the unsung heroes of cancer care. They help you with scheduling, they help you with questions that might not have to do with labs or films. With emotional needs, we have a social worker who can help, sometimes with therapy sessions, with meditation sessions. I always encourage my patients when they finish their treatment to get back to a normal life as much as possible.